a paltry 3.87% of the budget goes to the health sector. 19 years down the line, after the 2001 AU Heads of Government Declaration in Abuja to give 15% to the health sector financing, Nigeria has only been able to get to 6.03% in 2012. Ever since then, we have hovered between 3% to 5%. That is not very encouraging. And of course, the COVID pandemic outbreak has now exposed how fragile, how weak, how abysmal the Nigerian health sector and the Nigerian health system has been. Of course, partly due to poor funding. Funding is not the only challenge we have in the health sector that had put us abysmally low. Of course, across the African continent, we rank 38 out of 53 countries that were assessed on health financing. And so if you also consider that Nigeria is within the first 5 with the worst record of infant and maternal mortality, with the worst records in HIV AIDS, you will worry more if you also take note that life expectancy in Nigeria is among the worst across the globe. So healthcare financing in Nigeria hasn't been optimal, and it should have gotten better because of the review we had of the budget following the pandemic. Let me ask Nigerians this evening. We have had several borrowings for infrastructure. What percentage of all those huge debts are we investing or has been invested in the health sector? The answer is none. And so it's worrisome. The average person in Nigeria should worry. Do you know why? We spend, if not for COVID-19, annually, we have capital flight of over 400 billion, more than the amount we budget for health, as capital flight for medical tourism. The president needs to do more. It's part of the promise he made. He needs to end medical tourism, and the only way to end medical tourism is to address the issues in the Nigerian health sector. There's an urgent need for a health reform, and that reform should be speaking to issues about clinical governance and leadership. It should be speaking to issues about infrastructure. It should address issues about personnel. There's a global WHO tool for addressing workforce in the health sector. I wonder why we are yet to fully operationalize that in Nigeria. That is one of the things that will end the challenge we recently had when the resident doctors embarked on their 6-day strike because of the non-implementation of agreements and the hazard and the inducement for COVID. What is that tool? The tool is what is called workload indicator staffing need. Is WISN, W-I-S-N. We need to deploy that tool, and with that, we will address the issue of personnel. We also need to look at every tertiary health institution in Nigeria as it is aptly a going concern. That has not been done. You see, the worry is that every health facility in Nigeria, including the one in my backyard, a primary health care center, is listed and appropriated in the Appropriation Act annually. The question we need to ask is how much of those figures in the Appropriation Act really gets released in overall. Now we have about less than 400 billion in this year's budget. How much of it will be released? These are the issues we need to address. We need to speak to the issue of governance structures and leadership. I worry because at the time in this world and in this country, our hospitals, like the UCH Ibadan, was ranked among the first 7 hospitals in the Commonwealth of Nations, was ranked like any other hospital in the street of London. In fact, the UCH Ibadan used to be a center for medical tourism for the Prince of Saudi. Today, the reverse is the case, and the reason is not far-fetched. No Nigeria hospital has any form of accreditation. It's only one private hospital in Lagos that has accreditation. People who go abroad do not go because there's plenty money spent in those hospitals. They go because those